I hope you are fine and in good health. Today I selected a very hot topic of meth mouth. So what is meth mouth? First of all, we discuss the history of the meth mouth, which is first synthesized by a chemist in Japan in 1893. After that, in different countries, its manufacturing started, and in World War II, there were seen an extensive use of meth mouth in the soldiers due to prolonged use of the methamphetamine. So different terminologies were used to describe these drugs like ice, crystal meth, methamphetamine. So why there is extensive use of these drugs in the whole world? The main reasons are number one, the drug is easily available. Number two, the drug is cheap. Number three, it is easy to manufacture and synthesize the drug. Even we can synthesize it in our homes. And the dangerous fourth thing is dependence or addiction of this drug. So, first of all, we discuss its effects, its uses. In the past, this drug was used in necrolepsy, asthma, and in obesity. Why? Because it has strong sympathomimetic function. What will happen after its intake? It reduce or decrease our appetite or hunger. Second, it reduces pain. It reduces fatigue. What it will increase is our mental and physical performance, arousal of happiness, euphoria. He or she taking this drug thought himself or herself as a king or queen. So, what's the other problem with this drug is arousal or increase of libido. Sexual desires are increased. What are the consequences, especially in homosexual patients? HIV, human immunodeficiency virus manifestation like AIDS, syphilis, gonorrhea, or other sexually transmitted diseases will occur in these patients. So, what will happen in the oral cavity or within our mouth? First of all, whenever we take this drug in different from different routes like injection, inhalation, or via an injection, this drug act on our salivary glands and reduce the secretion of our saliva, which is called as xerostomia or dry mouth or cotton mouth. What are the consequences of xerostomia in our oral cavity? The first and important is rampant caries, and the caries pattern are very distinctive or very typical pattern of smooth surface caries involving the buccal surfaces towards the cheeks of the molars, and in the anterior proximal surfaces, the surfaces in between the anterior teeth like incisors, laterals, and canines. So these rampant caries simulate the caries in the children which which are on bottle feeding. So one thing is rampant caries, and second thing is erosion. Erosion is basically happen due to some acids. So main our drug is basically acidic. Methamphetamine is acidic. Second, the patient is taking acidic drinks like colas drinks, cokes, and sweeteners in their diet. Other than these things, in meth mouth patients, there are problems of GERD, gastroesophageal reflux disease. Their stomach acid reflects towards oral cavity. And one important condition is bulimia nervosa, in which patient intentionally vomit after the intake of the food. So all these factors ultimate results in erosion of the teeth, acidic attack on teeth, and the removal of the outer covering of the teeth, which is called as enamel, and the whole condition is enamel erosion. So first rampant caries and second is erosion. And third important thing which also help in destruction of our teeth is grinding of the teeth. And interesting thing is that grinding of the teeth it happens in dead patients which are on the homemade methamphetamine, which is usually contaminated and results in grinding of teeth, clenching of teeth, also called as bruxism. So the clinical picture of meth mouth is cotton mouth or dry mouth, short length of teeth due to teeth grinding or acid attack due to erosion of the teeth, swollen gums due to poor oral hygiene. In these patients, there is also neglect of the oral hygiene. And another thing is these patients are on high carb diet, which is also acidic. So all these things destroy our teeth. A beautiful smile converted into a horrible smile after few years of intake of the meth mouth or methamphetamine. The usually half-life of the methamphetamine is 10 hours, while in the patient taking intravenously via injection, the half-life is 12 hours. So the drug is very toxic to our teeth, our mouth, our muscles, our facial muscles. The usage of this drug, prolonged usage especially, results in stretching or spasm of our facial muscles, which results in limited mouth opening, lockjaw, or trismus. So we should give awareness to our new generation in publics, in schools, in different communities to avoid usage of this drug. What is the role of dentist? Dentist's role is as a recovery agent. If we detect the condition early, we can stop the problem as early as possible. And the main thing in this is counseling of the patient. Number two, stoppage of the drug. Number three, early prevention of the patient teeth to prevent from dental caries like brushing twice a day before going to bed and after and before the breakfast, and use of dental floss once a day. Application of fluoride varnish is very important to prevent the dental caries in the future. In- Increase intake of water is very important as there is dry mouth in this condition. Sometimes we have to use, in later cases, pilocarpine to increase salivary secretion, artificial saliva to lubricate our oral cavity to decrease the incidence of infections, mucositis, and dental caries. So the role of dentist is very important in the prevention or further progress of meth mouth, and as a whole to prevent the patient's sufferings from other medical conditions also. As methamphetamine also affects our kidney, lead to kidney failure on our heart, increase our blood pressure, can lead to heart attack or myocardial infarction. So these are very aggressive complications of the methamphetamine. Sometimes we can treat this condition with the help of psychologist or psychiatrist. The role of psychiatrist and psychologist is also very important in this condition because the patient is dependent on drug abuse. So there is teamwork basically. First, the role of dentist in identification and detection of the disease of meth mouth, and then he will consult with the psychiatrist or psychologist for further stoppage of the condition. So this informative video, hopefully you like it, and also give awareness to your surrounding pupils, which is very important. Like where you are working in some factory, in some government sector, whatever and wherever you are working and going, spread the message. Spread the important message of stop, avoid usage of methamphetamine. Stop, avoid the usage of methamphetamine or ice or crystals cause it's toxic to your body. Not only in your mouth but also the whole body is affected by prolonged use of the methamphetamine. So hopefully you will find this video very informative, and last but not least, take care of yourself, your surrounding peoples, your family members, your friends, your colleagues, by giving awareness, by guiding them to avoid the bad habits. Thank you.